Here's my rubric with nothing written on it. Hello, my name's Haley Ridgway. I'm going to be your SVSU student nurse today. Can I just start by getting your name and date of birth?
Andrew Rogers, January 10th, 2006.
Alrighty, and then can you tell me where we're at today?
Your house.
And then what's the year?
2035.
Alrighty, and then do you have any allergies?
I don't.
Alrighty, so I'm just going to be gathering a head to toe assessment on you today. But before we start, I'm just going to do a brief health history on you. So just answer all of my questions to the best of your ability. To start, do you take any medications? This can be over the counter or prescribed.
I don't.
Alrighty, and then do you take any vitamins, herbal supplements?
Nope.
Alright, and then have you ever had any history of like major hospital stays or surgeries?
Nope.
And then do you have any pertinent family history of disease?
No.
And then do you have any personal history of any like health conditions, past or current, that I should be made aware of?
Nope.
And then how often do you drink alcohol?
I don't drink.
And then how often do you smoke? This can include tobacco products, vaping, or marijuana.
I don't smoke.
Alrighty. And then I'm just going to ask about urinary continence. So do you ever have any trouble making it to the bathroom on time, or like problems when you're coughing or sneezing or like wetting the bed at night?
No.
Alrighty. And then how often do you exercise?
Every day. I try to.
Every day. And what do you usually do for exercise?
Conditioning or weightlifting, usually.
Okay. And then what does your diet look like?
I try to eat 3 times every day, a variety of foods, and I drink a lot of water as well.
Okay. And do you feel like you get enough to eat?
Mm-hmm.
Alrighty, so based on your answers to all of those questions, I'm comfortable moving forward. But before I start, I just want to make sure, are you in any pain today?
No.
Alrighty, so I'm just going to start by grabbing your vitals. Do you have an arm that you would prefer I did your blood pressure on?
No, I don't care.
Alrighty. I'm just going to go ahead and do this arm. Do you know where your blood pressure usually lies, higher or lower?
I think it's normal, usually.
Normal. Alright, slide this arm now. Alrighty, I'm just going to feel for your brachial pulse. Alright. Alrighty, that was 122/82, and that's normal. Alrighty. Next, I'm just going to go ahead and take your pulse. I'm going to take it on your radial pulse right here. Alrighty. Then pulse was 72, respirations were 16. Now I'm just going to go ahead and check your pulses for symmetry. So I'm going to start with your radial pulses. Symmetrical. And then your brachial pulses. Symmetrical. Alrighty, now I'm just going to go ahead and take a look at your hands. I'm just looking for any signs of clubbing. I don't see any signs of clubbing on you, but if I did, that would indicate to me possible oxygen deprivation. Next, I'm just going to go ahead and check capillary refill. Capillary refill is indication of perfusion. And your capillary refill was symmetrical and in less than 3 seconds, so that looks normal. And I don't have anything to take your temperature today, but if I had a thermometer, I would assume your temperature would be about 98.6. And then if I had anything to take your SpO2, I would assume it would be about 96 to 100%. So next, I'm just going to go ahead and take a look at your arms. Temperature feels good. Skin looks normal. I see you have a couple moles and freckles. Is that normal for you?
Yeah, it's normal.
Do those give you any pain or issues?
Nope.
Alrighty. Muscle tone feels symmetrical. Now I'm just going to do a couple exercises to test your strength and range of motion. I'm just going to have you start by squeezing my hands. Good. And then pull my hands. Right? And then push them. And then try and push my hands together. And then try and push them apart. And then push them up. And then down. Good. Strength looks good there. Next, I'm just going to do a couple exercises to test your range of motion. So I'm going to put my hands on your shoulders and have you do a swimming motion. Alrighty, I noticed a couple crackles there. Is that normal for you?
Yeah, it's normal.
Any pain or issues with that?
Nope.
I'm going to go ahead and have you push your shoulders forward and then backwards. Alrighty, range of motion looks good. Now I'm just going to go ahead and test cranial nerve number 11, which is your accessory nerve. So to do this, I'm just going to put my hands on your shoulders and have you push against them. Good. And then turn your head this way and then that way. Alrighty, so cranial nerve number 11 looks nice and intact. Next, I'm going to go ahead and take a look at your head. Any pain or tenderness?
Nope.
Alrighty. I'm just looking for any abnormalities on your scalp. Do you ever have any pain or excessive dryness?
No.
Alright. Alright, that's good. I notice your head and face are nice and symmetrical. While I'm over here, I'm just going to palpate your occipital lymph nodes. These are non-palpable. Alright, then your post-auricular, your pre-auricular, submandibular, submental, cervical, and I'm gonna have you hunch forward like this, and your supraclavicular. Already, all of those were non-palpable. If any of them were palpable, I'd be worried about possible infection or malignancies, but none of them were. Now I'm over here, I'm just gonna go ahead and check skin turgor. So I don't see the presence of any tensing. If I did, that would indicate possible dehydration to me. Next, I'm gonna go ahead and check your sinuses. Do you have any issues with your sinuses?
No.
Alrighty, so if you can move your hair out of the way. Frontal sinuses, any pain or issues with that?
No.
And then maxillary, any pain or issues?
No.
Alrighty. Next I'm just going to go ahead and test cranial nerves 5 and 7, which is your trigeminal and facial nerves. Those are responsible for the sensory and motor functions of the face. So to start, I'm just going to have you make a couple faces. So I'm going to have you smile, and then frown, lift your eyebrows, and puff your cheeks. Good. Okay, so now I'm just gonna have you close your eyes and I'm gonna touch a couple different spots on your face and just have you tell me where I'm touching. So go ahead and close your eyes.
Left cheek, nose, chin, forehead, right cheek.
Good. So it looks to me like cranial nerves 5 and 7 are working and intact, so I have no concerns there. Next, I'm just gonna go ahead and test your cerebellar functions. So to do this, I'm just gonna have you make an OK sign with your hands and then touch your fingers to your thumbs and then do it as quickly as you can. Good. Next, I'm going to have you put your hands on your thighs, then flip them upside down and right side up, and then do that as quickly as you can. Good. Next, I'm just going to have you look at me, and I'm going to hold my pen light out, and I just want you to touch your nose and then touch my pen light. So go ahead and touch your nose and touch my pen light, touch your nose and my pen light, touch your nose and my pen light. Good. So it looks to me like coordination is nice and intact there. Next, I'm going to go ahead and move on to your eyes. So how often do you visit the eye doctor?
Yearly.
Yearly? All right, that's good. That's what's recommended. Do you have any pain with your eyes?
No.
Any issues seeing?
No.
Do you wear contacts or glasses?
Nope.
And then do you have any light sensitivities?
No.
All right, so I'm just going to start by assessing cranial nerve number 3, which is your oculomotor nerve. To do this, I'm just going to have you stare straight at me. And, well, right before I do this, I'm just going to check this. I'm going to have you look up. Alrighty, and then look down. Good. So your conjunctiva is nice and pink and your sclera is nice and white. So now we're going to go ahead and test cranial nerve number 3. Again, oculomotor. So I'm going to have you stare straight at me and I'm just going to shine my light into your eyes. Good. So pupils were equal, round, and reactive to light. Now I'm just going to test to make sure they're also accommodating. So to do this, I'm just going to have you look at my finger and then back at my pen light. So look at my finger and back at my pen light. Look at my finger and back at my pen light. Good. So it looks like your pupils are also accommodating. Next, I'm going to go ahead and check cranial nerves 3, 4, and 6, which is, again, your oculomotor, your trochlear, and your abducens. These are mostly responsible for eye movement. So to do this, I'm just going to have you follow my pen light with your eyes. Good. Now I'm going to have you look right at me, and I'm going to check your corneal light reflex. I'm just going to shine the light. Good. Reflection was symmetrical between the two. So it looks to me like cranial nerves 3, 4, and 6 are working and intact. Next, I'm just going to go ahead and move on to your nose. So to do that, I'm just going to have you look up. I'm going to shine my pen light into your nose. Nasal mucosa looks normal. I notice the presence of turbinates. I don't see any polyps and no deviation. So that all looks normal to me. Do you ever have any issues with breathing?
No.
Alrighty, so I'm just going to have you plug one nostril and then take a breath in and out. Good, and the other one. Good. So next I'm going to test cranial nerve number 1, which is your olfactory nerve. This is responsible for smell. So to do this, I'm just going to hold something up to your nose with your eyes closed and have you breathe it in. Before I do this, I just want to make sure you do not have any allergies.
No, I don't.
Okay. So you can close your eyes.
It was like coffee or coffee grounds.
Yep, so it's coffee grounds. So I would say that cranial nerve number 1 is working and intact. Next, I'm going to go ahead and move onto your mouth. I'm just going to have you open your mouth, and I'm going to shine my pen light in there. Good, and have you smile with your teeth, and then pull your lip down. Good. So it looks like your oral mucosa is nice and wet and pink, and then I didn't notice the presence of any cavities or lesions or like any chips in your teeth. So all of that looked normal to me. Do you ever have any issues with any of those things?
No.
And then how often do you visit the dentist?
Like every 6 months.
Like every 6 months? Okay.
Yeah.
So now I'm just going to go ahead and check cranial nerve number 9, which is your hypoglossal nerve. To do that, I'm just going to have you stick your tongue out and move from side to side.
Okay.
Or I'm sorry, that's cranial nerve number 12, your hypoglossal nerve. Go ahead and stick that out and move from side to side. Good. Next, I'm going to test cranial nerve number 9 and 10, which is your glossopharyngeal and vagus nerve. So to do this, I'm just going to stick this tongue depressor in your mouth and have you say, ah. Good. So I noticed that your soft palate and uvula moved up and forward, and that indicates to me that those nerves are working and intact. And additionally, I heard you say, ah, while you were doing that, so that indicates that cranial nerves 9 and 10 are working and intact. Next, I'm going to go ahead and move on to your ears. I'm just going to shine my pen light into your ears. I don't notice the presence of any excessive earwax or blockages. Do you have any problems with your ears?
No.
Any pain?
Nope.
Any issues with hearing?
No.
Alrighty, so I'm just go ahead and feel. Any pain with that?
Nope.
Alright, I don't notice any abnormalities. Any pain with that?
Nope.
Alright, I don't notice any abnormalities there either. So I'm just going to go ahead and take a look at your neck. Temperature feels normal. Skin looks normal. Your trachea is nice and aligned. I'm going to go ahead and you don't ever have any issues with breathing?
No.
And I don't notice either over here the use of accessory muscles to breathe. So right now I'm just going to go ahead and feel your carotid pulses. I'm going to feel them one at a time. Good. Good. Now I'm going to go ahead and listen with my stethoscope to your carotid pulses. I'm just listening for something called a bruit. If I heard it, it would be like a swooshing sound in my stethoscope, and it would indicate possible blockage or aneurysm.
Right.
So I'm going to go ahead and listen with the bell in my stethoscope, and while I do this, I'm just going to have you hold your breath. No bruits. Then again, just hold your breath. No bruits. Alrighty, both of those looked normal to me. Now I'm going to go ahead and move on to behind you. I'm just going to go ahead and check your thyroid. So to do this, I'm just going to pull your trachea to the side and then feel it when you swallow. So you can go ahead and swallow. Good, and then go ahead and swallow. Alrighty, and I didn't notice the presence of any nodes or masses, so everything looks normal to me there. Let's get back. Alrighty, so now I'm just feeling your back. Temperature feels normal. Skin looks normal. I noticed a couple acne moles. Is that all normal for you?
Mm-hmm.
Did those give you any issues?
No.
Alrighty, I'm just going to pull this down if that's all right.
Mm-hmm.
All right, so I'm just looking at your spine. Your spine looks nice and in line. Have you ever been diagnosed with scoliosis?
No.
Alrighty, and do you ever have any pain or issues with your spine?
Nope.
All right, so I'm just going to go ahead and do something called chest expansion. I'm going to have you take a deep breath in. Good, and lung expansion looked normal, and I noticed you have a 2-to-1 AV ratio, and that is normal. Next, I'm just going to kind of have you stick these muscles out. Good. So now I'm going to go ahead and take a listen to your lungs. Every time I put my stethoscope down, I just want you to take a deep breath in. If at any point this gets too tiring or you need a break, just let me know. lung sounds were clear. I'm going to do something similar, but in the same order, but this time I'm going to be tapping on your back. If at any point this is causing any pain or discomfort, just let me know. Good, so I heard resonance there, so all of that looks to be normal. So now I'm just going to go ahead and have you lay on your back. And to start, I'm just going to take your pillow out from under you and have you look to the side. So right now I'm just looking for something called JVD, and I do not see it present on you, but if I did, I would raise the head of the bed 45 degrees, and if I still saw it present, I'd be worried about possible fluid volume overload. But I don't see it present on you, so I'm not concerned. I'll give you your pillow back. So now I'm just going to go ahead, I'm going to pull these out from your arms if that's okay. I'm just going to go ahead and look at your chest. Temperature looks normal. Skin looks normal. So right now, I'm just going to go ahead and take a listen to your heart. So to do this, I'm going to have to feel a couple different spots. So if at any point you're in any pain, just let me know. So how I'm going to do this is first I'm going to listen with my diaphragm, and I'm going to listen for like a normal heart sound, which is like a lub-dub sound. And then I'm going to listen with the bell of my stethoscope to listen for any murmurs. Okay? Alrighty. I'm going to start on your right side. I'm going to start at your clavicle and space, rib 1, space, rib 2, space, and this is your aortic valve. Left up. Nope, no murmurs. Alrighty. Next, I'm going to go ahead and move over here. Clavicle, space, rib 1, space, rib 2, space. This is your pulmonic valve. Go ahead and flip this. Alright, so I'm left up. And then no murmurs. And then come back up here, clavicle, space, 1, space, 2, space, 3, space. And then this is your herbs point. This is the point where I can hear your heartbeat the loudest. Left up. No murmurs. Alrighty. Now I'm going to start at your clavicle again. Space, rib 1, space, rib 2, space, rib 3, space, rib 4, and space. And then right here is your mitral valve. Left up. No murmurs. And then lastly, I'm going to come back up to the clavicle. Space, rib 1, space, rib 2, space, rib 3, space, rib 4, space, rib 5, and space. I'm going to come over here, mid-clavicular line, and me over here. And right here is your apical pulse. Left up. And no murmurs. So next, I'm just going to flip it back to the diaphragm and listen for 1 full minute, because this is the spot where your pulse is most accurate. Alrighty, then apical pulse was 72. Now I'm gonna go ahead and just take a look at your abdomen. See some slight pulsations from your aorta. I'm gonna come down here. I don't notice the presence of any obvious peristalsis, no swelling, edema, or lumps. Alrighty. Now I'm just gonna go ahead and take a listen. I'm just gonna go ahead and listen to each of the different quadrants for your bowel sound. So if you wanna put this back on, and I'll just expose your abdomen. Pull this up. Vowel sounds present. Vowel sounds present. Vowel sounds present. And vowel sounds present. So vowel sounds are present in all 4 quadrants. So now I'm gonna go ahead and listen to your abdominal arteries. So I'm gonna listen with my bell for a bruit again. So I'm gonna start at your xiphoid process and your umbilicus, meet in the middle. Right here is your aorta. No bruits. I'm gonna come right off to the side. Those are your renal. No bruits. Come back over here. Back to the other side. No bruits. I'm gonna slide right down. This is your iliac. No bruits. And then come over here. That's your other iliac, and no bruits. So all of that sounded normal. Now I'm just gonna go ahead and do something similar to what I did on your back, and I'm gonna percuss. So right now I'm listening for something called tympany. And I heard tympany. Now I'm gonna go ahead and percuss again, but this time I'm gonna be percussing for your liver border. So I'm gonna start down here, and I'm gonna first hear tympany, and then I'm gonna move up until I hear dull, which is then gonna be your liver. So right now I'm looking for any signs of like a distended liver or enlarged liver. So went from tympany to dull, so your liver starts about over here. Next I'm gonna go ahead and do light palpations. So if at any point you're feeling any pain, just let me know. Any pain or issues with this?
No.
Alrighty. Now I'm gonna go ahead and do deep palpations. Let me know if you have any pain or issues with this. Any pain or issues?
No.
Alrighty, and I didn't notice the presence of anything abnormal. So now you can pull this down. And I'm just gonna go ahead and feel for your femoral pulses. So to do this, I'm just gonna kind of have you do like a frog motion. I'll start over here. So I'm feeling right here for his femoral. And I'm gonna leave that right here and feel on the other side as well for symmetry. And those are symmetrical. And I'm gonna go ahead and listen with the bell of my stethoscope for any bruits. I'm gonna be listening right here. No bruits. And no bruits. Alrighty, now I'm just gonna take a look at your legs. Color looks good. I don't notice the presence of any swelling. Temperature feels good. I'm just gonna go ahead and feel your different pulses. So I'm gonna start with your popliteal, that's just right under your knees. Alrighty, those are symmetrical. And I'm gonna go ahead and take your socks off if that's all right.
Mm-hmm.
Alrighty. Alright. I'm gonna go ahead and feel your posterior tibialis. Those are symmetrical. And then your dorsalis pedis. and those are symmetrical. So I'm just gonna take a quick look at your feet. Skin looks intact and normal. I don't notice any abnormalities. Do you have any issues or pain with your feet?
No.
Any excessive dryness?
Nope.
All right, I'm just gonna take a look between your toes. Everything looks normal. And I'm just gonna check the capillary refill in your feet again. Again, that's an indication of perfusion. Alrighty, and capillary refill again is less than 3 seconds and symmetrical, so I have no worries there. So now I'm gonna go ahead and do something called a sharp and dull test, and then like point localization. So basically this is going to be sharp,
okay,
and this is going to be dull.
Okay.
And then I'm going to have you close your eyes, and I'm just going to put either sharp or dull, and I just want you to tell me if it's sharp or dull and then where I'm at.
Okay. Sharp right thigh. Dull left shin. Oh, sharp left shin. Dull right knee. Dull left thigh. Sharp right shin. Dull right foot. Dull left foot.
Good. And you got most of those right. If you would have gotten a lot wrong, I would have been concerned about possible peripheral neuropathy or loss of sensation in the legs. But you didn't, so I'm not concerned there. So now you can just go ahead and put your socks back on. I'm just going to wash my hands just because I was touching your feet. And did you want me to tie your gown back up in the back?
Sure.
Alright, I'm just going to have you swing your legs over here. Alright, so right now I'm just going to feel your legs again. Temperature's good. Color looks normal. Muscle tone is nice and symmetrical. I don't notice the presence of any edema. I'm just going to do a few things to check, like your muscle tone and your range of motion here. So I'm just going to have you push up on my hand. Good. And push up on my hand again. Good. Then I'm going to have you push my hands in and then push them out. All right. I'm going to have you push up on my hands, push down on them. Good. And then push my hands in and then push them out. Good. Then I'm just going to have you turn your feet in and then out and then around. Notice a little bit of crackling. Is that normal for you?
Yeah, it's normal.
Any pain or issues?
Nope.
Alrighty, so it looks like range of motion and strength is nice and intact there. Next, I'm just going to go ahead and check your patellar reflex. I'm just going to have you close your eyes and I'm going to check your reflex. Good, so reflexes look nice and intact. I'm going to have you stand up in just a second, but before I stand you up, I just want to know, are you experiencing any dizziness today?
No.
Alrighty, so we're going to go ahead and get your shoes on. Alright, so you can go ahead and stand up. So lastly, we're going to test your cranial nerve number 8, which is your vestibulocochlear. This nerve has 2 parts. The first one is hearing, and the second one is balance and equilibrium. Based on the fact that you can hear me when we're talking, and you said earlier that you didn't have any issues with your hearing, I would say your hearing is nice and intact. Next, I'm going to test the balance and coordination part. So to do that, I'm just going to have you stand feet shoulder width apart, then put your arms by your sides, and then just close your eyes. Alrighty, I didn't notice anything of you being off balance or swaying, so I would give you a negative Romberg and say that your cranial nerve number 8 is working and intact. Next, I'm just going to have us walk a little bit. We're just going to walk normally, and I'm going to stand right next to you, just in case you're feeling dizzy or anything. So we're just going to walk a couple steps forward. Good. And then this time we're going to walk heel to toe. Good. So everything looks nice and good there. Balance and gait looks nice and intact. And I would give this patient a Braden score scale of 23 based on the fact that they're not at risk for increased moisture from urinary incontinence. They have no mobility issues. They exercise every day and they get a nice variety of food in their diet and they eat 3 meals a day.